Good afternoon and welcome to the DNP orientation session. We are going to wait just a little bit longer for some more individuals to log on, but we will be right back. All right, good afternoon again, everybody, and this is the Doctor of Nursing Practice orientation session. My name is Amy Brill. I am a university counselor here with Grand Canyon University, and we are going to get started with the presentation now. If you do notice over on the right-hand side of your screen, there is an orange arrow. If you do have questions, please go ahead and type in the question area, and we will stop periodically throughout the webinar as well at the end, take some time to answer all of your questions that you do have. First, I do want to make sure that everybody can hear me, so please go ahead and answer the poll that shows up on your screen if you are able to hear me. Waiting for a few more individuals to go ahead and vote to make sure that they are able to hear the presenter speaking. All right, it looks like everyone has voted, so I'm going to go ahead and close this. And again, my name is Amy Brill, and I am joined today with Dr. Amanda Ziemendorf, who is our DNP program lead. So first of all, congratulations to everybody for starting their DNP journey. You all are in class and hopefully are doing well so far. Just a little background on us is that we are a private, Christian, and affordable university. We are regionally accredited through the Higher Learning Commission. And as you can see on the slide, you're joined by numerous other students and faculty, both full-time and adjunct as well.
So welcome, I am Dr. Ziemendorf, and I'm the DNP program lead, as Amy mentioned. I just want to thank you for taking the time to join us today. We are so excited for you as you start this exciting journey. There's a lot of exploration, inquiry, fellowship with other scholars, and many professional possibilities that go along with your academic journey and the opportunities that you may find after the conclusion of your journey. Today in orientation, we just want to give you some information and some tools that will help you be successful as you start to navigate the coursework.
This slide is just an overview of the different topics that we are going to cover today. We're going to go over the purpose, time design, your hours, site mentors, the different systems that you'll be using, and then a lot of time will be covered on the DPI project. This is the outline of what we're going to go over for the purpose, the time, and design for the DNP. The first thing that we are going to cover is defining what that practice doctorate looks like.
So we do get this question a lot regarding what exactly is the practice doctorate. The practice doctorate seeks to prepare nurse leaders at the highest level of nursing practice. It is very clinical. You have a practice immersion experience, and the goal is not to do original research, but to translate existing knowledge from research and literature into practice to go ahead and improve patient outcomes. So primarily what you'll want to be thinking about is, how does my work in this program prepare me to be a change agent, to make a difference, to take what is known or established in knowledge and apply it, to give life to research. We want our learners to use clinical, organizational, and economic leadership skills in order to do those things and effectively critique information and literature and knowledge that comes about. We want to go over some of the essential characteristics of doctoral candidates: being organized, having the time commitment, and really engaging in the material in the classroom. There's a lot of autonomy as a doctoral learner, and so you will really want to take advantage of all the resources in the classroom and think about how those things might help you with your individual and unique DPI project. A lot of people ask us, what is the time commitment? And while we can't give you an exact time commitment for every student, this can vary, but most people share that they are devoting about 20 hours a week to their DNP coursework. Sometimes that will be more, and sometimes that will be less. And it also depends on your strengths and weaknesses and areas of opportunity for growth. So if there's a particular area of subject matter that you're covering, it may take you longer to navigate that and apply the information than if you're dealing with an aspect of the curriculum that you're more familiar with. So it's just very unique and varies by learner. The courses, most of them will have a minimum of 50 practice immersion hours, and that is a minimum. If you are ever encountering issues with that, you'll want to reach out to your counselor, but it is a minimum of 50 hours per course after 801 until you get to the project courses. Our curriculum is based on the AACN DNP Essentials and the Non-Nurse Practitioner Core Competencies.
This is the timeline for your program. So as you all probably have seen your course schedule, this is broken down to show what classes are your core courses, which are shaded there in green, and then the last 3 courses are going to be your project courses. And like Dr. Ziemendorf said, your immersion hours do start in 8:05, and it shows how many hours a minimum are required in each of the classes. And then when you get to the DPI, it shows that there's 33, it's 100 hours broken up over those 3 courses. And then also it does kind of show where those milestones throughout your program are for the pre-direct practice improvement project courses, and then the milestones as you go through your DPI project classes.
We want to talk a little bit about the comprehensive assessment. At the beginning of the program, this is probably not going to impact you as much. This is something that you'll complete later in a course prior to your project courses. And the comprehensive assessment includes a final self-reflection where you are synthesizing things that you've learned and providing evidence that you've attained the AACN and NONS core competencies. The purpose is to appraise your ability to integrate that knowledge, which is essential in demonstrating that you're able to move forward with your project.
So now we're going to talk a little bit more about the practice immersion hours. So as a DNP learner, you're required to provide evidence of 1,000 post-baccalaureate hours that have demonstrated achievement of those AACN Essentials and the NLNPA Practice Doctorate competencies. So you're able to transfer in up to 500 hours from your MSN program, and you've probably already had this discussion with either your university counselor, your SSC, or your field experience counselor, and you will be notified of how many hours actually transfer in at the beginning of your second class is usually when that is notified to you. But how do you evaluate those hours? So you can kind of figure out on your own how many hours would be transferred in. For APRN students, a certified minimum of 500 practice hours can be transferred in, and typically that's what we see with our advanced practice nurses, is that you do have the 500 hours automatically transfer in. For non-APRN students, we look at 50 practice hours for each credit that your practicum or capstone was. So if you had a capstone course that was 4 credits, that would translate into 200 practice hours transferring in. A lot of times you've already been working on your practice site and mentor, but looking at a little bit more in depth as to where are you going to do your practice immersion hours. This may be direct or indirect patient care within a clinical setting. We usually recommend that your current place of employment is favorable because you're already at that site. However, it doesn't have to be. So if it's somewhere else that you would like to do those hours, you definitely can work with a field experience counselor to get those additional sites approved. There just needs to be a defined line between what is considered employment and immersion hours. When doing your documentation, you must have purposeful documentation with reflection in there. You are able to have multiple practice locations. Just keep in mind that for each location, you're going to have that site and mentor approved. So it is possible to have additional sites, but it may require that you have additional approvals on file. Academic settings such as colleges are not appropriate, so it does need to be in a clinical site. When looking at your mentor, the mentor must be an expert in their clinical or administrative area. And again, the Office of Field Experience will collaborate with you and the partner as far as getting the site and mentor approvals completed. They will let you know what documentation is needed to be collected, but they are usually the ones that are going to work directly with your site to get the approval done. Again, the students will work with your field experience counselor. You probably have already had contact with them. If you have not reached back out to them, if they left you a voicemail or sent you an email, I definitely recommend reaching out to them as soon as possible. Some of the sites we may already have approved, others it might be an initial approval, and that can sometimes take 2 to 4 months to complete to do an affiliation agreement. The site is what determines what documentation we need to collect. So from the start, we don't know ahead of time what information you will need to provide, but some of it might be health and safety documents. Even if you are already employed there, sometimes they do require them again. And then the mentor will usually need to provide their resume as well as some additional paperwork to get them approved. When looking at who can be your mentor, here are some examples of who that may be. A professional with a doctoral degree. It does not necessarily have to be somebody with their DNP, but it is sometimes nice to have a mentor who has gone through what you're about to embark on because they're able to give you some inside tips as to what they were able to do, or they understand what the project is going to entail. It might be an advanced practice nurse that has considerable experience or expert certified in a particular clinical field. It could be an MD. It might be a CEO or a CNO within a healthcare organization, and again, a doctoral prepared nurse. Now we're going to look at some of the different systems that you will be using. The first thing is LoudCloud. So LoudCloud is your learning management system that you are currently in your classes with. You should have had your counselor go through and show you how to use the classroom, where to post things. If you ever have questions with the classroom itself, definitely please reach out to your counselors. They're able to go through it again with you, make sure that you are comfortable on where to locate items. The instructors are going to expect that you do look at all of the different areas within the classroom to locate items prior to reaching out to them. So again, if you're having trouble finding anything, either in the classroom or the library, please reach out to your counselors.
We're going to talk a little bit about Typhon. This is a very important part of your ability to demonstrate that you've completed your practice immersion hours. You really want to stay on top of Typhon. You will not need to use it so much in 801. There's a practice assignment, but beyond that, this is where you will log all of your hours. You will only want to use the case log function. If you use a different function, such as the time logs, then you will be logging your hours in the improper place, and this becomes very problematic because we can't get the instructors to go back and approve those hours after the fact in most cases. So you'll just really need to make sure that you're logging your hours as you do your assignments. When you finish an assignment, put it in the Dropbox. I recommend immediately going into Typhon, completing your case log, which has different areas in it. We'll go into that a little bit more in detail here in a moment, but you'll complete your case log right away. You need to do that within 2 weeks of actually doing the hours. So this is what it looks like when you log into Typhon, and you'll have an account number assigned. You'll put your user login and your password in there. And then after you click on login, you will see, this is what you will see. You see the menu. And the easiest way to remember where to go is to start at number 1. It's the very first option that you have. And if you use that Add New Case Log, you will be in the right place. The only exception are the education emphasis courses, but instructions are given in those classes if you choose to add those 3 courses to your core. So in all the courses, you need to add a new case log. The other really important platform that we use is DC Network, and Amy already touched on that just a little bit, but it's very important that you are going to the DNP workspace. There, the DC Network houses a lot of templates. It houses discussion question form, or I'm sorry, not discussion question forms, but question forums where you can ask department questions. There's a folder for every class, so you can go in there and click on the course that you're in and obtain the necessary materials. This is just going to be a very important platform for you to become familiar with. If you go to dc.gcu.edu, then you will go to the general DC Network platform where all the doctoral programs go. Just be very cautious, because if you go there, you could potentially get information that's similar, but not completely correct for DNP. So it's important that you go to dc.gcu.edu/DNP. This next screen gives you an idea of what you should see. So you will log in and you will see DNP Practice Immersion Workspace at the top. And so you want to make sure that you're only working within the DNP area of DC Network. If you go into the other areas, you could possibly use templates that are incorrect. They're so similar for some of the templates as ours that they may not always be caught right away until the end, and you've been using the wrong template all along. Okay, this is what I was talking about with program documents. So if you click on the little folder, let's go back one more slide, I'm sorry. You see the little folder down underneath the picture right there. It says DNP Program Documents. If you click on that, then you will be taken to this next screen, and that's where you can access your documents for your classroom.
So in the next section, we're going to dive a little bit more into the Direct Practice Improvement Project and what are those expectations, which I know a lot of you have been either working on or in the process of doing your PICO statement.
So with project expectations, it's really important that you understand that the purpose of the Direct Practice Improvement Project is to translate existing knowledge into practice. In other words, it's really important that you identify a problem in the healthcare setting and attempt to solve it through the implementation of an initiative or a project, and then measure the outcome. Measure what impact that initiative had on patient outcomes or practice outcomes. This should not be a retrospective project, and it should not be a project that occurs in academia. It must occur in the clinical setting. Education can become an important part of these projects, but just make sure that you are not solely relying on that education as your only intervention. You want to make sure that you are measuring something more than just knowledge. So if you are implementing an initiative, a program to be rolled out, you may have to do some education, but you're also going to measure the impact that had on your patient or practice outcomes. So how do you identify a project topic? It's important that you first look at what the practice problem is. So let the problems in the healthcare setting that you're going to conduct your project, let those issues inspire your project. It should still be interesting to you. You will be stuck with this concept, and I say stuck with it, you can mold it, but at a certain point it becomes pretty difficult to change it. It's not impossible, but you want to try and get a good solid project from the beginning so that all your work goes toward that concept. So it is good if it's interesting to you. And this visual here, it also talks about, is it interesting to someone else? When I see that, I think, is it interesting to the site? What about the stakeholders? Are they interested? If they are not, and they do not view this as a problem, you may have difficulty gaining buy-in or gaining their support in implementing your project, which can become a major barrier to your successful completion of your project. Is it defined as a need in literature? So not only is it needed at the site, but is it needed? Do you have evidence that it's a need in practice? Is it evidence-based? Is there a solution that's evidence-based or an innovation that's related to an evidence-based solution? And is it manageable? When we talk about that component, you want to make sure it's something that's feasible, that's not going to be too expensive to implement, that's going to be thought of as reasonable for the practice site, sustainable. Is it ethical? So as you develop your PICO, you'll look at these, and PICO is broken up into the different parts, P-I-C-O-T. So population, we do encourage you to avoid vulnerable populations such as incarcerated individuals or children. If you choose those populations, it can be very difficult to get through IRB. A pediatric population comes up quite a bit because we have a lot of people that work in that sector. It's not impossible to do something related, but you'll want to get really creative and think, am I really working with the caregivers? Am I working with the parents? And you just have to be really careful, because sometimes even when you're working with the parents, you're doing interventions that impact the patient, the pediatric patient, and then they are still your population. So you just want to be careful to design a project that's acceptable, ethical, and that's not going to be too difficult for you to get through IRB and in the time frame that you're allotted. So your intervention, we want you to use existing, valid, and reliable tools. What does that mean? That means we want you to, if you're using a survey, we want you to find a survey that's been validated, that's been used, and ask for permission from that author to use the survey. So a tool or an instrument is another word for a means by which you're collecting your data. We already kind of touched on feasibility. The comparison is really important. You can't just gather a bunch of information and data. You must compare to see if your intervention made a difference. So you have to have an action item, which is your intervention, and see if that intervention made a difference. So if I'm wanting to do my project on falls, I can't just assess all the reasons why we might have falls in my hospital. I'm going to have to determine whether or not, I'm going to have to come up with a solution, implement it, and determine whether or not that solution was effective in a significant way. So for time, it's really important that you design a project that can fit within the time frame for the DPI. Usually our students are looking at 2 to 8 weeks for implementation and data collection. It can be very challenging. It is doable, but you want to make sure you're planning for it ahead of time. And you're going to want to make sure you have enough time to get the participants that you need.
And very importantly is to know where to go when you need help. So a lot of the information that you might have questions on, you can go to the DC network. Again, as Dr. Ziemendorf mentioned, you want to make sure you're going to the DNP specific one, and also the Graduate Field Experience Manual for any program questions that you might have. You also can always reach out to your university counselor. Again, they are usually your main point of contact and can point you in the right direction if you have any questions about the content of your classroom, your assignments, definitely make sure you're reading all of the announcements and everything, and then reach out to your instructor for that information. But all the resources that you have include your faculty, your program chair, your SSC, your field experience counselor, university counselor, IT. Make sure you're utilizing the librarians. You also have access to the tutors if you need help with maybe proofreading or statistics. You do have access to those tutors as well. I always recommend, if you reach out to your faculty, to do it through the individual form in LoudCloud in your learning management system. That way everything is documented that you can go back and reference to if you ever have questions as well. But again, make sure that you are reaching out for help if you need it at all. So that actually concludes our webinar for today. Please enter any questions that you might have or thoughts or comments in regards to the webinar over on the right-hand side of your screen, and we will definitely get those answered for you. I do have a question that came through. Is there a required sample size for the DPI project?
We want you to use a sample size calculation to determine your sample size, but generally a good rule of thumb is to at least make sure you have 10 participants in the end. It's really difficult to obtain approval on a project that wasn't fully implemented and that you didn't really, you need to have enough people to demonstrate that you actually intervened in practice.
Great question. Do we have any other questions?
I think I want to clarify a little bit further on that sample size. 10 is not the only number that you would want, it's not something you want to shoot for. That would be most likely a minimum, and it wouldn't always be appropriate for every project. So you want to make sure you're actually calculating what kind of sample size you need using your appropriate statistical analyses. And so for some people that looks like 60. For some people it's hundreds. For some people it's 10, but if you have 2 participants or 1 participant or 4 participants, it can be very, very difficult to demonstrate that you achieved the overall competencies and the goals of the DPI.
Another question, is the PICO question able to be adjusted after submission for approval?
Your PICO question can be adjusted. If you do that, if you adjust your PICO after the department provides feedback to you, then you just want to go through your instructor and see if they can give you some guidance, especially if it's dramatically changed. Another option is to reach back out to the PICO inbox and ask if they would have time to do an additional PICO review for you. But I would start with the course instructor.
Great questions. Does anyone else have any other questions? All right, doesn't look like we have any questions. We will stay on the line for a couple more minutes, so if you do, go ahead and send them through. If not, go ahead and want to thank you for joining us this afternoon, and we wish you continued success in your journey. All right, it doesn't look like we have any additional questions. So once again, I want to thank you for your time today, and I hope everybody has a great afternoon.